Hello, everybody. Welcome to a new episode of the Dissenter. I'm your host, as always, Ricardo Lopes, and today I'm joined by Dr. Richard Redding. He is Ronald D. Rotunda, Distinguished Professor of Jurisprudence and Professor of Psychology at Chapman University. Dr. Redding's research focuses on forensic issues in criminal law and juvenile justice, the use of social science research in law and public policy, scientific evidence, and legal education. And today we're going to focus our interview mostly on sociopolitical values and diversity in psychological research and clinical practice. So, Dr. Redding, welcome to the show. It's a pleasure to have you on.
Thank you. I'm pleased to be here.
So tell us first, from a psychological perspective, what are socio-political values, and what do you think are how do you think we should talk about socio-political values when it comes to how they might affect scientific research and academia more generally?
Mm-hmm. Well, socio-political values are political attitudes and values relating to social issues. And they're usually the kinds of things that have dominated what people refer to as the culture wars in recent decades. So, anything from abortion, which of course is a very hot issue again nowadays, but abortion, school prayer, school choice, parenting issues, sexuality issues, gender issues, a whole range of political issues relating to social and moral values. And they really are very important to people. The old saying, the personal is the political, or the political is the personal, is all the more so nowadays in the politically polarized climate that we live in. And so they impact people in a variety of ways, and they impact psychological research, and they impact clinical practice.
So, and how do they impact psychological research specifically?
Well, psychologists, like all researchers, have values invested in what they research. So psychologists often research issues that have some, the issues that they choose to research, they choose to research those issues because they have often some personal relevance to them. And this is especially the case when it comes to research on social and political issues. And so there's been a lot of research done and a lot of examples we can point to where when psychologists are researching social issues and political issues, their own values, their own politics, their own views on those social issues influence how they do the research. It influences everything from, as I said, what issues they decide to research to begin with, and then how they frame research questions, how they approach research questions, how they design their research, and especially how they interpret the findings of research.
Could you give us an example of
that? Sure. So, for example, psychologists going back as far back as the 1940s started researching what they called the authoritarian personality or the conservative personality. And so, and there's been a lot of research done in the field of social and political psychology on, what's called the conservative personality or the authoritarian personality or the conservative psychology as compared to the psychology of liberals. And this research, for example, has found that as compared to liberals, conservatives tend to be less tolerant, less open-minded, less open to new experiences, more dogmatic, more prejudiced, and so forth. But this research was conducted almost without exception by political liberals. And so the way they defined conservatism, they would tend to conflate it with authoritarianism. They would focus on researching those aspects of personality that would tend to cast conservatives in a negative light and liberals in a more positive light. And so, for example, more recent research tends to find that, does find actually that liberals are no less biased or prejudiced than conservatives, that bias exists on equal measures on both sides of the political equation. The early researchers only focused on authoritarianism on the right, but pretty much neglected the issue of authoritarianism on the left. For example, the more recent research tends to also find that conservatives tend to be happier, more conscientious than liberals. And so the point being that, you know, what you decide to focus on, what variables you decide to focus on, how you frame those variables. There was also some research done earlier in an area called symbolic racism, for example, where they measured people's racism and they developed racism scales. And they conflated, you know, if you had particular views on particular social issues, and that was classified as constituting part of the racist personality. So another example that I can give you is that there was more recently there's been research done over the last 40 years or so looking at the effects on children being raised by gay or lesbian parents as compared to heterosexual parents. And you know, all of that research showed that there were no differences between gay parenting and heterosexual parenting. But then about 10 years ago, a sociologist by the name of Regnerus did a study, and his study was one of the largest done to date, and he did find some differences. And his study was widely attacked by other academics. But what's interesting is that his study was probably, all of the studies in this area of research have methodological problems because it's difficult to do research on that topic. So they all have methodological limitations, including his. But his probably had fewer than most. And yet all the previous studies that found no differences were widely accepted and supported and used in advocacy work by psychologists to support gay adoption laws, gay marriage laws, and so forth. But yet his study that came along that probably had fewer methodological limitations was widely attacked because the findings weren't what those in the academic community found to be very appealing. And I should note that I've written on this topic myself on gay parenting and gay adoption, gay marriage, and I'm very supportive and have been supportive of all of those things. But I think when it comes to looking at research, we need to, you know, to the extent we can, leave aside our own political preferences and just try to look at the research just as purely scientifically as we can with our scientist hat on. But as I said, noted at the outset, that's difficult to do because scientists have their own values invested on research on these kind of hot button political topics.
Mm-hmm. But since at a certain point there you mentioned that research shows that liberals and conservatives, or the left and the right, people from both sides are equally biased. I mean, we have to worry about biases coming from both sides, right? I mean, it's not that we should worry more about liberal biases than right-wing biases or conservative biases or vice versa, because I mean, if they are equally biased, then I mean, for example, the examples you gave focused mostly on biases coming from the liberal side of the aisle, but perhaps that's mostly because the vast majority of people who do academic research in psychology tend to be liberal, but if they were conservatives, we should be worried, but in the opposite direction, right?
Yes, and that's a critically important point. So yes, we need to be concerned about bias coming from both directions. But when it comes to academic research in psychology, for example, as a practical matter, we need to be much more concerned about bias coming from the left, simply because the overwhelming majority of research done in psychology is done by academic psychologists who are overwhelmingly left of center. And I can actually share some data with you on that if you would like. There have been a number of studies conducted over going back all the way back to about 1950 on the politics of the professoriate. And these studies universally find that, especially nowadays, that the professoriate tilts strongly to the left. So, for example, if you look at psychology, for example, only about 5% of psychology professors are right of center. The other 95% are left of center, and the imbalance has been growing greater ever since about the year 2000. So overwhelmingly, the research done in psychology is going to be done by those whose own politics are on the left. And so simply for that reason, it's more of a concern of bias on the left. But absolutely, if the situation were reversed and psychologists were 95% conservative rather than 95% liberal, what we'd be talking about instead of liberal bias in research or clinical practice is conservative bias. There's no question about that.
So do you think it's because of that it's important to have viewpoint or ideological diversity within academia?
I do. And I think when it comes to research, it's very important to have that. And it starts with who the researchers are themselves. And I think we need to diversify who it is that's doing research. And that means diversify viewpoints on the faculty, because again, I keep coming back to the fundamental point that people who do research on these hot button social and political issues often have their own views invested in those issues, their own values. And it's very hard to get away from that entirely, no matter how much one may try to be unbiased. Even unconscious biases come into play. And so fundamentally, it requires achieving diversity in who's doing the research. As well, another useful strategy is to have what one of my colleagues, Phil Tetlock, calls, and Corey Clark call adversarial collaborations, where people with different views on a particular issue come together to decide to undertake a joint research program on that issue. And they specify a priori what their hypotheses are and so forth, and what kinds of results would tend to support one side of the issue versus the other side. But fundamentally, it requires diversifying who it is that's doing the research.
And how do you think we could get more diversity in academia? Because, I mean, let's say that, for example, the fact, I don't know if that's true or not, you can tell me, but let's say that the fact that we have more liberal people in academia, and particularly psychology, is just due to the fact that because liberal people tend to be more open to experience, they are more prone to preferring academia and academic positions and research positions than conservative people. I mean, if that's the case, is that really something we can change or not?
Mm-hmm. There are two main reasons for, actually three reasons for the lack of sociopolitical diversity on faculties. One is what you just pointed to, that it is the case that, and there have been studies done on this, that conservatives tend to prefer, for example, careers in business, careers in the real world, so to speak. So to begin with, there's a certain self-selection effect out of academia by conservatives. But then greatly compounding that problem is the fact that, when they're in college, when let's say a young libertarian or centrist or conservative student, and I don't want to have this conversation focus only on conservatives, because not only do we need to diversify the faculty in terms of more conservatives, we also need more centrists on the faculty, more libertarians on the faculty, more people who are even politically agnostic on faculty, right? But when those students are in college and they might start to think about pursuing an academic career, they quickly come to find out that an academic career might be kind of hostile to their politics. They might not feel comfortable in academia. They quickly come to pick up the signals and the values in academia, and many of them find that that's not, probably wouldn't be to their liking. There's research showing that people tend to opt out of careers that they find aren't consistent with their values, including consistent with their political values. And there have been studies done which show that conservative college students, as compared to liberal college students, for example, report, although they have the same GPA and the same GRE test scores, but they report having more distant relationships with their faculty, fewer opportunities to do research with faculty, and so forth. And that's probably due to the fact that they feel a little alienated from the values and views and perspectives of the faculty member, as does probably the faculty member from those students as well. And then finally, a final thing that you have at work is there have been recent studies done which document very explicitly overt discrimination against non-liberal students, especially socially conservative students in academia and faculty members. So there have been surveys done, for example, where faculty in psychology very freely admit, I mean, this is not covert discrimination, this is not subtle discrimination, this is overt, explicit discrimination, where they say, yeah, I would be less likely to vote to hire a faculty candidate if I knew that he or she was conservative, or I'd be less likely to support their grant application if they were proposing to do research from a conservative perspective. I'd be less likely to, if I were a peer reviewer on their manuscript submitted for publication, I'd be less likely to recommend it for publication. There have been studies looking at that also suggest a similar kind of discrimination when it comes to admission to graduate school. So you have a combination of these three factors of a certain self-selecting out to begin with, the fact that non-liberal students may find the academic environment in graduate school and careers in academia to be not very accepting of, not very welcoming of their values and their viewpoints. And then finally, you have overt discrimination. So you put all those things together. And as I mentioned, the research shows that faculties are becoming increasingly tilted towards the left since 2000. And that's probably because there's this snowball effect that develops, right, over time, where we also know from a lot of research in social psychology that people prefer people who are most like themselves. Likes attract, opposites don't attract. That aphorism is wrong. Likes attract. And faculties are no different than that, like in that regard, than anybody else. They're going to want to hire people who are most like themselves, including most like themselves in their values, their viewpoints, their attitudes. And so over time, this is just kind of a snowball effect. It just builds and builds and builds. And so that's kind of the problem.
So do these issues surrounding sociopolitical values extend to, for example, clinical psychology and clinical practice? But I'm asking you that because in this case, I mean, the practical applicability of clinical psychology is a bit more obvious, I guess.
Yes. Yes, absolutely. Before we move off, however, of the issue of research in academia, I would just like to mention for interested viewers that there's a new organization that's formed in the last year or so that I'm the president of, called the Society for Open Inquiry in Behavioral Science. Again, that's Society for Open Inquiry in Behavioral Science, and your viewers can Google that and pull up our website, webpage, and it's an organization that's been formed, designed to try to promote viewpoint diversity and psychological research in academia, well, not just in psychology, but in the behavioral sciences generally, in research in academia, and also in practice. So moving on to practice. Yes, it has a huge impact on clinical practice in a variety of ways. So the first impact that it has is that, and there have been studies done on this as well recently, that clients or patients, whichever you want to, however you want to refer to them, often bring to the table when they come for psychotherapy sociopolitical values issues, or issues relating to sociopolitical values. So, for example, they may want to, and I did a study of this where I surveyed clients who have been in therapy recently, and a significant percentage of them report bringing these to the table with their therapist. So, for example, a client may want to talk about sexuality or gender issues. They may want to talk about parenting issues. They may want to talk about difficulties they're having with relating to friends or coworkers or family members who have different political views than they do. That's really becoming an issue nowadays in therapy, believe it or not. There's a host. They may want to talk about, views or anxieties they have about anything having to do with climate change, to who the current president is, to, you'd be surprised how often these issues come up in therapy. So that's one implication. The second implication, and probably the most significant one, is that we know that differences between the therapist and the client can affect what we call the therapeutic relationship, which is really the bond between the client and the therapist. And we know from a lot of research that the therapeutic relationship is probably the most significant factor affecting the success of therapy. It's kind of the sine qua non for being able to have successful therapeutic outcomes. And again, because likes tend to attract and dislikes tend to repel, when you have too much of a therapist and client mismatch when it comes to sociopolitical values, that can lead to a number of problems. It can lead to the therapist not really having empathy for the client. It can lead to the therapist not really understanding the client. It can lead to communication problems between the client and the therapist. It can lead to sociopolitical bias by the therapist against the client, and what we call countertransference. And this may seem odd, well, why would political views of the client or the therapist, why would that affect the therapeutic relationship, especially in situations where neither the client nor the therapist expressly raise political issues, right? The reason it can have an impact is that, if one thinks about when you initially meet people and get to know them a little bit, most of us have a pretty good idea. It's really funny, but if you think about it, you can tell pretty quickly what a person's politics are. You just pick up on that, you get a certain vibe. It doesn't take long to get to, even if you never discuss politics, you can pretty easily speculate what the person's politics might be. And usually you're right, even if you never discuss politics. And that's because politics are actually a very important part of people's self-identity. We don't really think about this too much, but there have been, we could spend the rest of the day talking about the research that I'm going to briefly refer to here in the next 5 minutes. But there's been research in social psychology, clinical psychology, a field that we call behavior genetics, over about the last 30 years, which in a nutshell finds the following. So when it comes to behavior genetics, we know, believe it or not, that there seems to be a relatively strong genetic component to people's political views. It's not that there are genes that code for, whether you're going to be a Republican or Democrat, but there are a variety of genes that code for personality and temperament factors, which in fact in turn have a significant effect on the politics you come to adopt. So these studies have found, for example, a pretty strong genetic component to people's views on particular social political issues. So views on gun control, views on abortion. So it seems to be like a pretty basic part of us, even down to our genetics in some sense. As I said, politics are very closely linked to people's personality and temperament patterns that develop early in life. And people's sociopolitical views are kind of function in a way for a lot of people, not for everybody, but for a lot of people as almost kind of a kind of religion for them, which is why you see people getting so passionate about politics and so demonizing people on the other side politically, because people's political views and their views on social and moral issues. And another thing about sociopolitical attitudes is that not only do they implicate politics, but they often implicate morality as well. So you have that in the mix. And so these kinds of issues are a way that people have to make sense of the world, to understand the world, to understand their place in the world, to understand different values operating in the world and how they relate to them. And so they're very important to people. In fact, there have been some very ingenious studies done where they will set people up in situations that in some way kind of subtly remind them of their own mortality, that you're going to die someday. So they'll do things like they'll have somebody give a presentation and show a picture of a fatal car crash, on the screen for some ostensible reason. And then later on, they'll get people together to discuss their political views, and that they find that when you do that kind of manipulation that reminds people of their own death, they become more passionate about their political views, less tolerant of other people's political views. And that's because, and we think the reason for that is, again, people's political views is a way of giving them a sense of security, a sense that they understand the world, that they're grounded in this very confusing world of ours by certain fundamental values that are important to them. So that's why these sociopolitical values can really affect the therapeutic relationship, and they can affect how the clinician relates to the client, how the client relates back to the clinician. They affect, in the study I did that I mentioned, I had a good number of clients report that, when they raised a socio-political issue with the client, and these were with the therapist, and these were almost always situations where you had a conservative client expressing their conservative political values with the therapist, and most clinical psychologists were liberal, just like most psychologists are, that they felt that the therapist kind of they felt that their therapeutic relationship changed in some way, that the therapist kind of was dismissive of their values, or tried to change their values, or tried to change the subject. Who knows how accurate those perceptions are, but there's certainly a lot of reason, both theoretically and in terms of research that's been done, to suppose that those perceptions probably are accurate on the part of those clients. So, political values by therapists finally affect the therapeutic choices they make. A lot of therapies, especially some of the newer ones that have come along, have political values embedded in them, either explicitly or implicitly. So in all these ways, sociopolitical values can affect clinical practice.
Mm-hmm. And I mean, perhaps a good historical example of how conservative values historically might also have influenced certain clinical practices would be conversion therapy a few decades ago, when people trying to convert homosexual patients into heterosexual ones, right?
Absolutely. Absolutely. That's a great example. So two current examples that we can give, one from the left and one from the right, in terms of values explicitly influencing politics, explicitly influencing therapy, is what you just mentioned, conversion therapy, which was developed by conservative therapists, and the whole goal of conversion therapy, hence its name, is to convert someone from a homosexual lifestyle to a heterosexual lifestyle. Coming at it from the left, more recently is a development known as social justice counseling, where the counselor comes to the therapeutic dynamic, particularly when it comes to counseling minority clients, from a social justice perspective. So with a focus being on issues of discrimination, issues of systemic racism, issues of oppression, and so forth. And that's the focus. So yes, two great examples we can get, one coming from a left political perspective, another from a right political perspective, very explicitly influencing therapy.
But do you think that if clinicians know the socio-political values of their patients, they should adapt their approach to the socio-political values of the patient, or at least they should take that into account when establishing, as you said, their therapeutic relationship and orienting them, also to particular therapies and all of that?
Right. Well, I think that they should take into account the client's values in a couple of ways. So first and foremost, I think the most important thing for therapists, especially when the therapist's values differ substantially from those of the client, are to adopt a stance of what some refer to as cultural humility. That is, be humble about your own values. Don't assume that your own values are superior to those of the client, and be open-minded and be accepting, and be empathic and understanding the client and his or her values. That does not mean, I just want to be really clear, that does not mean that the therapist has to adopt the client's values, accept the client's values, or like the client's values. It just means they have to be open-minded to understanding those values, being empathic with the client, not making every attempt that they can make to not be biased against the client in any way because of their values, not attempt to change the client's values, and to try to also understand the role that the client's socio-political values may be playing, not only in the client's presenting concerns, but in the client's life more generally. How may they be affecting the client's interpersonal relationships? How may they be affecting the client's relationships with family members and friends, work functioning? How may they relate to the client's presenting concerns? The reason I mention how may they be affecting clients' relationships is because there's also a lot of research showing that nowadays people are really making selections based on friendships, mate selections, hiring, etc., based on the political values of who they're dealing with in those contexts. And so they could be very well affecting their relationships with others, or impacting them in some way. They might be relating to their presenting concerns in ways I mentioned previously. So the therapist should attempt to understand to the extent it's relevant. In a lot of therapeutic situations, it's not going to be relevant. But to the extent it's relevant, in a lot it is going to be relevant. However, the therapist should attempt to understand the client's values, the salience and importance of those values to the client, and how they may be affecting the client's functioning and presenting problems. And then the therapist should think about, how can I maybe leverage the therapeutic approach or leverage the client's values to be a benefit in therapy. So say, for example, you have especially religious client. Well, the therapist might be able to leverage the client's or use the client's religious values in therapy. So there have been some modifications, for example, of traditional cognitive behavior therapy for religious clients that are found to be especially helpful for those kinds of clients. Another thing that's important for therapists not to do is not to pathologize the client's values. There was an example recently in the literature where a group of therapists saw a client for therapy who was a strong Trump supporter, and much of what they were talking about, in terms of how they should address this client's problems were, well, what kind of pathologies must he have that is leading him to be such a strong Trump supporter? That would be an example of pathologizing a client's values just because the therapist finds them to be distasteful to the therapist. And that's also something that we ought not to do. And then finally, just more generally, there's been for many years now an emphasis in the various mental health disciplines on what's called being culturally competent in psychotherapy, mm-hmm. which is taking into account racial differences, gender differences, issues of sexual orientation, disability, age, and so forth. But left out of that discussion has been the issue of political values. Actually, values generally haven't really gotten a lot of attention in that discussion, but political values or viewpoint differences especially haven't really gotten much attention. And we need to consider in our discussions of cultural competence what it means to be culturally competent from a socio-political and values and viewpoint perspective.
Mm-hmm. And particularly when you mentioned the kinds of relationships people with different socio-political values might establish in their intimate lives, let's say, one thing that came to mind was that, and please tell me if this is right or not, that people with different socio-political values, I mean, it's not that they are, let's say, exclusively political, because they are tied to their personality and moral values as well. They usually live life in different ways. They have different lifestyles, and some of them, particularly in the social context they might find themselves in, might prefer a non-normative way of life, let's say, perhaps because they are religious in particular contexts, or they might have different social or sexual, orientations, identities, and all of that. So, I mean, the therapist should probably take all of that into account and respect that when trying to help orient the client, right? The client or
yes,
the patient.
Absolutely. Oh, yes, there are a number of factors that have been found to be linked with or correlated with political values and socio-political values. And you're absolutely right. Studies are showing that, people are sorting themselves according to socio-political values in a variety of ways, everything from where they choose to live to who they select in dating to friendship choice, hiring, and the hiring issue gets back to the discrimination issue we talked about previously. And this kind of sorting by sociopolitical attitudes seems to be accelerating within the last decade or so. So, if you go back to go back 30, 40 years, nobody would have thought to have been one of the first things that they ask on a first date is, what are your politics, right? Nowadays, that's one of the first things people ask, And so, yeah, it's becoming more and more of an issue, again, as our society becomes increasingly politically polarized.
Mm-hmm. So one final question then. Do you think then, how should we deal with these issues? Do you think that, for example, clinical practitioners should have some training in political psychology, moral psychology, personality psychology, and all of that? Do you think that would be a good approach, or would you suggest some other things?
Well, I think what needs to be done is we need to explicitly incorporate training on these issues in graduate school with graduate students in their cultural competence classes and multicultural classes. Nowadays, all programs require graduate students in clinical psychology and the other clinically related disciplines, counseling, psychology, school psychology, to take a class relating to cultural competence or multiculturalism. So we need to incorporate a discussion of these issues into those classes, which we have not done to date. And in continuing education programs for clinicians who are in practice, we need to address these issues as well. We also need to address these issues in students when they're doing their clinical internships and residencies and in what we call clinical supervision. And in that regard, I would direct your viewers who are interested to literally hot off the presses recent article of mine, which talks about all these kinds of issues with respect to clinical practice. And the title of that piece is Sociopolitical attitudes sociopolitical views as the deep culture in culturally competent psychotherapy. Again, that's sociopolitical views as the deep culture in culturally competent psychotherapy. And that article just came out in the journal Clinical Psychological Practice. Mm-hmm. But I think, we also need to incorporate sociopolitical attitudes or political views into the ethical codes of the various mental health professions. And what I mean by that is prohibiting discrimination based on a person's political views. Currently, the only ethical code of the various mental health professions that does that explicitly is the code for social workers, the ethics code for social workers. But we need to have that incorporated into the ethics code of psychiatry, psychology, and so forth.
Mm-hmm. Great. So, Dr. Redding, just before we go, you mentioned that paper, for example. Where can people find you and your work on the internet?
If they... I think I got the title slightly wrong. I sometimes have difficulty remembering my own titles. It's actually Sociopolitical Values is the deep culture in culturally competent psychotherapy. But where they can find my work is if they just type in my name, Richard E. Redding, and Google Scholar, they should be able to find it there. The article I just referenced literally is just coming out, so they probably won't be able to find that quite yet. They may have to wait a few weeks before they can find that easily on the internet. But and again, also, I'd like to reference the Society for Open Inquiry in Behavioral Science, and if they type that in, they can find our webpage, which is currently undergoing some construction, but it'll be finalized here soon in a few weeks.
Great. So, Dr. Redding, thank you so much for taking the time to come on the show, and it's been great to talk to you.
Great. I enjoyed it. Thank you.
Hi guys, thank you for watching this interview until the end. If you like what I'm doing, please consider supporting me on Patreon or PayPal. You will find links to it in the description box of this interview. And also, please share the interview, leave a like, and hit the subscription button. This show is brought to you by Enlights Learning and Development Done Differently. Check their website at enlights.com. I would also like to give a huge thank you to my main patrons and PayPal supporters: Per Larsen, Jerry Mueller, Ernst Frederick Sunda, Bernardo Seixas, Olaf Alex, Jonathan Visser, Adam Castle, Matthew Whittingbird, Arno Wolf, Tim Hollis, Henrik Alenius, John Connors, Philip Force Connolly, Robert Windager, Rui Inácio, Zup, Marco Neves, Colin Holbrook, Simon Columbus, Phil Kavanagh, Michael Stormir, Samuel Andreev, Francis Ford, Tiago Nunes, Alexander Dunbauer, Fergal Cusson, Hal Herzog, Nuno Machado, Jonathan Librant, João Linhares, Stanton T, Samuel Correa, Eric Hines, Mark Smith, João Eira, Tom Hummel, Sardas France, David Sloan Wilson, Yacila Dez Araújo, Romain Roach, Diego Londonho Correa, Yannick Punter, Adana Rusmani, Charlotte Bliss, Nicole Barbaro, Adam Hunt, Pablo Ostazewski, Nelek Bach, Guy Madison, Gary G. Hellman, Saima Afzal, Adrian Yegi, Nick Golden, Paulo Tolentino, João Barbosa, Julian Price, Edward Hall, Edin Bronner, Douglas Fry, Franca Bortolotti, Gabriel Panos Cortez, Ursula Litska, Scott, Zachary Fish, Tim Duffy, Sonny Smith, John Wiseman, Morton Eichland, Dr. Bird, Daniel Friedman, William Buckner, Mau Maria, Paul George Arnaud, Luke Kloaki, Georgios Theophanos, Chris Williamson, Peter Wolozin, David Williams, Ruth Towell, Diogo Costa, Anton Erickson, Charles Murray, Alex Shaw, Amari Martinez, Coralie Chevalier, Pedro Bonilla, Ziegler, Bangalore Atheists, Larry D. Lee Jr., Old Herringbone, Sterry, Michael Bailey, Dan Sperber, Robert Grassis, Tom Roth, DR PMD, Igor N., Jeff McMahon, Jake Zoll, Barnabas Radix, Mark Campbell, Richard Bowen, Thomas Dobner, Luke Neeson, and Chris Story. A special thanks to my producers Isa Webb, Jim Frank, Lucas Stafiniak, Tom Vanagdam, Bernard Ugni, Curtis Dixon, Benedict Mueller, Vega Giddy, Thomas Trumple, Catherine and Patrick Tobin, John Carlo Montenegro, Robert Lewis, and Alnick Ortiz, and to my executive producers Matthew Lavender, Sergio Codrean, and Bogdan Kanivets. Thank you for all.